Let's talk about something that doesn't get enough attention: health insurance in Zimbabwe. The numbers are in, and they're honestly staggering. Imagine this: out of 16 million Zimbabweans, only about 640,000 have any form of health insurance. That's just 4% of the entire population, which means more than 14 million people, yes, 14 million, are completely uncovered. For more than a decade, the coverage rate hovered around 10%. Not great, but at least it was steady. Now, that's all changed. According to the latest Zimbabwe Demographic and Health Survey, we've seen a 60% drop, the lowest point in recent history. Back in the 2010s, about 1.6 million people had medical aid. Today that number has crashed. So what's actually going on? Well, most Zimbabweans are simply excluded from medical aid. Grace Kaura from Zimstat put it bluntly. The majority of the population remains uncovered by any formal health insurance. If you ask around, nearly everyone will tell you the same thing. About 94% of men and 92% of women have no coverage at all. Only a tiny slice, 8% of women and 7% of men, say they have health insurance. Now let's look closer. The most common way people get coverage is through their job. 4% of women and 3% of men get medical aid through work. Public or state-supported insurance, even less common, just 2% of the whole population. Put simply, if your job doesn't offer coverage, you're probably on your own. A decade ago, things looked a bit more hopeful. Among women, coverage nudged up from 7% in 2010 to 11% in 2015, but it's dropped again to 8%. For men, it crept up from 9% to 12%, then slid right back down. All those modest gains from the early 2010s, they haven't lasted. The consequences are serious. With hardly anyone covered, millions of Zimbabweans face a real risk, going without care or being pushed into debt by health costs. Experts warn this is a growing crisis. The government has talked about a national health insurance scheme, a policy that could help, but so far, it's still just an idea, not a reality. Rising costs and economic challenges make the situation even tougher. For most people, health insurance isn't just unaffordable, it's almost unimaginable. Without big reforms, Zimbabwe's dream of universal healthcare will stay just that, a dream. So while the numbers might sound like statistics, this is about real lives. And for millions, the safety net just isn't there.